Hi, I'm Crystal from the Diabetes Clinic here at the San Francisco General Hospital. I want to go over how to inject Ozempic. Ozempic is a hormone medication. It's not insulin, but you inject it once a week. This medication can help decrease your appetite, help you lose weight, and also level out your blood sugars to a more manageable level. Your doctor can prescribe this for you if you have type 2 diabetes. To start, you're going to take your Ozempic pen, take off the cap, and you're going to take an alcohol pad and clean the top of the area every time by counting to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You can let that dry, and in the meanwhile, you're going to set up your needle. So you'll take off the sticker, and then you're going to put your pen straight down, being careful not to bend the pen, and just twist to the right. Once you feel a little bit of tightness, you can pull the pen out and keep your cap. You're going to have a second cap. Take off the second cap and you can throw that one away. And we're going to prime our pen with a little bit of medication to make sure that our needle is working and that it didn't get bent while we were putting on our needle. So you're going to go from 0 in the window here and rotate it to the first line with a couple of dots. And we call this priming. So just make sure you squirt out a little bit of liquid. And you can either see a little bit of liquid at the end of the pen or a little stream of liquid coming out. If you see that, then we know that your pen is working and you're ready to give your dose. So we're gonna take our pen and we're gonna scroll down until you see that dose, 0.25. So 0.25 is your starting dose. This is to help your body get used to it. Some of the side effects you might feel are headache, nausea, or vomiting. If you feel these symptoms, don't worry. These are very normal and very common, and after a few weeks, your body will get used to this. If the nausea and vomiting are just so severe, let us know by calling the office and talking to your doctor about whether or not you may need to stop this medication. One of the more severe side effects is pancreatitis. So if you feel a lot of abdominal pain that starts to get worse, make sure you call your doctor or go to the nearest emergency room. So one of the benefits of this medication is it does decrease appetite, it helps you lose weight, and it helps control your blood sugar levels. So part of that is because of those symptoms of that nausea. So once you're at 0.25, you're gonna clean your abdomen, and I'm gonna use my fake tummy here today. So you're gonna pick an area of your abdomen. You can also inject in some other places. Just demonstrate here for today. You're gonna clean the area in a circular motion going out, kind of like a snail's shell shape. And you're gonna let the alcohol dry so that it doesn't sting when you inject your medication. And when it's nice and dry, you're gonna take your pen, hold it straight and parallel to the floor. You're gonna inject. Now you can hold and pinch a part of your abdomen. Make sure it's a large pinch and not a small pinch, or you can just flatten out. And you're gonna push your pen in. You're gonna wanna take a look at the window and you can push down and you'll hear a click when it gets to 0. Once it gets to 0, hold to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then you can pull your pen out. And you're gonna take your cap, put it back on your needle, and then twist the opposite way. And once your needle comes off, you can put it in the sharps container, not the trash. You want to store your Ozempic pen when you get it brand new from the pharmacy in the refrigerator, in the door where it's not too cold or where it could freeze. If you store it in the back of your fridge, it might get frozen and you won't be able to use the medication anymore. You also want to keep the pen out of sunlight, so not in your car, not in a window, but in a cool, dry place, so not the bathroom or the kitchen, but maybe the living room or your bedroom or in a cabinet, out of direct sunlight. If the package is new, you can put it in the fridge, but if it's being used, you can save it and store it outside of the refrigerator. And these are multi-use pens, so one pen could last you either a month or 2 months, depending on your dose. After a few weeks, your doctor may increase your dose to 0.5, and the final dose will be 1 milligram of an injection every week. If you have any questions, feel free to call us at your clinic in diabetes or at your primary care doctor's office. Thanks.